Hi, I'm Len Calabrese. I'm right here at ACR San Francisco. I'm from the Cleveland Clinic, and I had the absolute honor this morning to be in the pole position at the plenary session. I gave the first abstract at the first plenary talk. And we, working with Jeff Curtis and his colleagues at the University of Alabama, have quite clearly made a case that following shingles, the rate of stroke goes up for 30 to 90 days, and the more serious the shingles, the higher the rate of stroke. And in fact, after herpes zoster ophthalmicus, the rate of stroke may be increased by over 300% in the first 90 days. We think that this is biologically plausible. The epidemiology is sound. Herpes zoster lives in vessels. It's angiotropic. It's been identified in brains of people with and without stroke. And recently, Dawn Gilden at the University of Colorado has clearly demonstrated zoster in temporal arteries that are both inflamed and uninflamed. What does this mean to the rheumatology community? Well, first of all, we take care of a patient population that has 50 to 100% more herpes zoster than the general matched population. Secondly, we use drugs that increase the rate of zoster even far more greatly. Our patient population is underprotected by the vaccine, and we have to dance around contraindications using biologics. So there are studies underway, one called Verve by Kevin Winthrop and Jeff Curtis, to try to make a case that whether this is safe or not. And then the last point I will tell you is that in our study, we demonstrated that prompt diagnosis and treatment of zoster decreases or mitigates the risk of stroke somewhat. So the take-home message is this: we're rheumatologists. We make zoster for a living. We now know that it's not only a bad disease and a painful disease, but it's associated with an increased risk of stroke. It needs to be diagnosed and treated promptly, and we need to do a much, much better job getting vaccines to our patients. Thanks.